female reproductive system. Right, so just like we did in the male reproductive system, we want to see the system from the outside to the inside. Right, we want to look at it from the one that you can see, the one that are the structures that are visible, down to the ones that are internal that you cannot see with your immediate eyes. Right, so with a woman sitting in a lithotomic position, right, which means she's lying on her back with her legs open. Now, and you try to investigate the reproductive organ. Okay, the first thing you see is the labia, right? Labia for the both of them, the plural, and then labum when you're talking of a single or singular, just one of it. Alright, so there are two of them there, right? That is why you have the labia, right? And they are the labia majora and the labia minora. The labia majora is a bigger tissue, okay, of flesh covered with skin. It is the first structure you see just covering the female reproductive organ. And immediately you open the flap of skin. The next structure you see there is just a little sized labia majora. Okay, it is called the labia minora. Right? And once you open this structure also, then you'll now be able to see the other structures, okay, that opens to the external part of the female reproductive system. Right, so having looked at the labia majora and minora, the next thing you see are structures like the urethra, the opening of the urethra. You not see the whole length of the urethra, you just see the opening of the urethra just a few millimeters below the clitoris, and above the urethra you have the clitoris. The clitoris, some people have come to call it the rudimentary male penis. Okay, now as a child, a fetus, when a fetus is still in the developmental stage, all right, at one particular stage you may not be able to tell between which is a boy and which is a girl, because their sex organ develop almost the same. Okay, it is at the advanced stage of development that you now begin to see divisions in the sex organs, so that you now begin to see the female, the male tissues, fusing to form the scrotum and then the penis, and then the female tissues becoming rudimentary. Okay, so what would have become the penis now becomes rudimentary and then becomes a clitoris. Right, what you see as very small pointed structure just above the urethra. Right, and after the urethra, then from anterior superior to inferior, you have the urethra. You have the clitoris, you have the urethra, and then you have the vagina. Right, the vagina is an open space made up of muscles. Okay, the vaginal muscles. Alright, and as you move into the vagina, you see the vagina pathway. Okay, the vaginal wall, and as you move into the vagina, a few centimeters into the vagina, you begin to the size of the vagina is different depending on the age, parity, and also the different women. Alright, so that you can see the vaginal size of between 5 to 12 centimeter vaginal depth. Alright, so as you move into the vagina, you now have the next structure that you have there is the cervix. Okay, the cervix is closed at both ends. Alright, you have what is called the ox, okay, that divides the cervix from the vagina and also divides the cervix from the uterus. Okay, so the structure or the ox that divides the cervix from the vagina is called the external ox. It is called the external ox because it is more external, right? It is more outward. And then the one that divides the cervix from the uterus is called the internal ox. The cervix is quite short, Right. So as you move past the vagina into the cervix, the next structure you see past the cervical organs, that is the internal cervical organs, what you now see is the uterus or the uterus. Okay. Now the uterus, which is called womb for in our general language, the womb or the uterus is just between 7 to 9 centimeters. The size of the uterus is different depending on the age also of the patient, the parity of the patient. By parity, I'm talking about whether the patient is nulliparous or parous. And if the patient is parous, we want to know if the patient is multiparous. Okay. So by parity, we are talking of whether the patient has been pregnant or whether this is a patient that has not been pregnant before. Okay. So the size of the uterus depends on one, the age of the patient. It also depends on the parity, which has to do with whether the patient has been pregnant before or the patient has not been pregnant. And then lastly, it has to do with the endocrinology status of the patient. That has to do with the hormonal state of the patient. Okay, so I was saying that the size of the patient, the size of the uterus is just between 7 and 9 centimeters in length, between 5 to 6 centimeters, 4 to 6 centimeters in width, and then has a depth of 2 to 3.5 centimeters. Depth of 2 to 3.5 centimeters. Okay, so but these sizes, as I have said, differ. Right, and it changes. Okay, so you have a parabola, okay, an increase in graph and then a slope in the graph, so that as a child grows, the size of the uterus grows with the child, gets to a particular stage, and then begins to decline as the woman gets to menopausal stage. Okay, so in menopausal women and then postmenopausal women, what we observe are smaller uterus. Okay, now this is because of atrophy of the uterus, which means that the uterine sizes or the uterine size begin to shrink and reduce, atrophies. Okay, so you have smaller uterus in postmenopausal women compared to women of childbearing age. And also I talked about the endocrinological state of the woman, okay, which means that a lady that is going through a menstrual period, right, the size of the uterus will not be the same when she is not on a menstrual period. Okay, so we'll just talk a little about the menstrual cycle, but in our next class or in our next lecture, we'll be able to delve deeply into it. Okay, so when we talk about the menstrual cycle briefly, they'll be able to see the phases of the menstrual cycle, and they will now understand why the size of the uterus differ with the endocrinological state of the woman. Alright, so let me give a quick illustration of the female sexual organ from our graph. From this graph or from this diagram, we can see the female reproductive organ. We look at it in the AP or anterior-posterior view, and then we look at it from the lateral or transverse view. Okay, so what we have here is the bladder, just anterior to the uterus. Okay, I talked about the bladder, then I told us about the urethra, just about 4 centimeters long. Alright, so you see the urethra coming out from the bladder and then opening just above the vagina. And then we have the vagina here that leads up to the cervix. Alright, we have the cervix, and then from the cervix we now have the uterus. This is the uterus. Okay, and then in the uterus we'll talk also briefly about the uterus and then its adnexals or the appendages of the uterus. But let's also look at the uterus as in the anterior posterior view. Right, in the anterior posterior view we see the vagina, we have the cervix. Remember I told you that the cervix is very short, and then we have the uterus. Now this is the uterus, this is the myometrium, or the muscles of the uterus. This is the endometrial part of the uterus, and these are the adnexas, or the appendages of the uterus. Now the uterus has basically two parts. We have the fundal part of the uterus, which is the upper part of it, this place, as you can see, and then we have the body of the uterus. This is the body of the uterus, and this is where a child, or a fetus, okay, embryo, can be implanted, all right, after fertilization. Okay, now I told us about the adnexas, or the appendages of the uterus, and basically we have the fallopian tube, or what is also called the oviduct. All right, and there are two of them. They are bilateral. We have one to the right and the other to the left, and then we have the ovaries. The ovaries are just about 3 centimeters in length. Okay, and the ovaries contain the ovum. All right, the female eggs. All right, and we now have the fallopian tube. The fallopian tube is basically divided into three. You have the isthmus part of it, the isthmus, okay, that goes from this part to this place. You have the ampulla, the ampullary part of it, where you have where fertilization basically occurs, the ampullary part of it. And then we have the infundibulum, as you can see. It's like a finger-like, the infundibulum is like a funnel-shaped structure. Okay, we can see it here. This part of it is the infundibulum, all right? Funnel shaped structure, and it opens into what is called the fimbriae, right? The fimbriae. Okay, the fimbriae are like finger-like structures. They contain cilia, what is called cilia, right? The function of cilia, just as you also have in the uterus, the fallopian tube, is to sweep whether it is the ovum, or it is the fertilized zygote. All right, it sweeps it from this point into the endometrium of the uterus. Okay, so remember what I said earlier, that we have three parts of the uterus. Three parts of the oviducts, or the fallopian tube, and this is very, very important. Okay, the fallopian tube, the patency of the fallopian tube is very, very important in women that are looking to have babies. All right. Now, when we talk about primary and secondary infertility, most of the time, what we are looking at, all right, sometimes where the problem may lie is with the fallopian tube. If the patency of the fallopian tube is compromised, which means that if this tube is blocked for any reason bilaterally, okay, what you have is that, remember that for a woman to be pregnant, there has to be a release of ovum or oocytes, okay, the eggs from the ovaries. These are eggs, right? These are eggs. From this structure, we can see things that look like egg within the ovary, okay? Single of it is ovum, and then the plural is the ova. Alright, so now for fertilization to occur, there has to be movement of sperm cells from the vagina through the cervix and the uterus into the ampullary part of the oviduct. Okay, this is where fertilization takes place. Okay, now if there is any compromise in the patency of this tube, two things are going to happen. The sperm cells will not be able to get to the eggs to fertilize it, and if by any chance it happens to get there, all right, now because the sperm cells are very, very small compared to the ovum, all right, if by any chance it happens to get there after fertilization, the eggs will not be able to move back into the endometrial part of the uterus to implant, and what happens is what we now call ectopic pregnancy. Okay, Now, if there's any blockage here and then the sperm cells manages to get to this place and fertilize it, instead of the eggs to move down back into the endometrial part of the uterus for implantation, what now happens is that the zygote, or the just fertilized egg, begin to grow. It grows into morula, and then you now have gametogenesis taking place, all right, and then the eggs now begin to grow and grow into fetus, and then we now have a baby growing around the fallopian tube, and that type of pregnancy is called ectopic pregnancy. It is very painful, it is dangerous, and should be detected early. Okay, so when a woman is pregnant, it is good for the woman to go, or when she begins to see signs of pregnancy, it is advisable for us to go for ultrasound scan, right, so that they can trace the baby, all right, the fetus, the implantation, whether it is properly implanted, or whether we are looking at ectopic pregnancy. And this calls to mind pervaginal bleeding, especially when it is not a menstrual period. Ectopic pregnancies like this can cause pervaginal bleeding, right? When there's eruption of this ectopic pregnancy, you begin to have lower abdominal pain, you begin to have pervaginal bleeding, and then other relating signs of eruption of ectopic pregnancy. So when you see signs like that, when you have lower abdominal pain, don't just conclude it may not be ectopic pregnancy. Other things can cause lower abdominal pains, okay, but your first point of call should be an ultrasound. Go to a diagnostic center, do an ultrasound, check your pelvic region and see what is happening there. All right, so let's return to our welcome back. Remember that it is very important that from time to time you check yourself, do ultrasonographic tests of your pelvic region as a woman, and also as a man. It is very important. I forgot to mention, but as a man from the age of 40, it is important that you take time to check your prostate, okay, and ultrasound test can do that very, very well, okay, because from that age of 40 and above, you begin to look at the possibility of prostate or BPH, okay, benign prostatic hypertrophy, okay, and early detection will do a whole lot of good. So do not shy away from ultrasound examinations, okay. As a man, you want to check your pelvic region, you want to check your prostatic region. The chances of then developing benign prostatic hypertrophy, that is BPH, from the age of 40 is very, very high. So make sure to check yourself from time to time. And then as a woman, I was saying, it is also very important that you check your pelvic region. The female pelvic region is quite different from the male pelvic region. All right, the female reproductive organ is completely different from the male reproductive organ, which makes the woman more vulnerable to infections. Why? Because of the open nature of the female reproductive or sexual organs. Okay, hence it is very, very important that from time to time a woman does an ultrasound examination of her pelvic region and does some lab examination like HVS, vaginal swab, urine MCS, urine culture examinations. These exams are very, very important for a woman from time to time. So do not let a year go by without running any of these tests. It is very, very important. And as I told you, there are a lot of places that these tests can be run, okay? A lot of diagnostic center. But if you want to have any discussion or you want to reach me, you can always meet me at Royal Image Diagnostic Center. We can have discussions, we can run these tests for you, and if you have any other question, you can ask and then we'll help you with it. Alright, so let's continue. I was talking about the female organ, the female reproductive organ, and I told you about the oviducts. right? The fallopian tube. While talking about it, I mentioned infertility, okay? Primary infertility, secondary infertility. Maybe on a good day we will have time to discuss infertility at length, okay? But I was going to also say about the fallopian tube, okay, and why sometimes exams like hysterosalpingography, HSG, could be helpful, right? The reason is, remember when I talked about uh, compromise of the patency of the fallopian tube? Or sometimes it may not even be the fallopian tube. Sometimes we may have what is called Asherman syndrome or synechia of the endometrial wall. Alright, this kind of situation is seen mostly in women that have gone through D&C, okay, dilatation and curettage, right? Or women that have, for one reason or the other, had scarification of the endometrial wall. Okay, now during the healing process of this injury, sometimes what can happen is a situation where there is what the joining of the endometrial wall. Usually, as we saw in that diagram, the endometrial wall is supposed to be open so that you can have the movement of sperm cells and then the implantation of fertilized egg. Alright, but if we have situations like Asherman syndrome or synechia, where you have the joining or the fusion of the walls of the endometrium, then it now makes it very, very impossible, almost impossible or very difficult for sperm cells to pass through the uterus and get to the oviduct, the ampullary part of the fallopian tube, to fertilize the egg. Alright? Or even if it manages to go through and then fertilization takes place, there will be no place for the fertilized egg to implant. And then what do you now have? You now have what is called ectopic pregnancies. And that is when you now find out that a woman cannot give birth to a baby, or a woman is finding it very, very difficult to conceive. Okay, this can happen even after a woman had first had an issue. Okay, like a woman that has been pregnant before and delivered can also have situations like this. All right, so that brings to mind the what we call primary and then secondary infertility. Alright, so I was talking about the ovaries, and I told you that the ovary measures about 3 centimeters in length, and then that the ovary contains what is called the ovum, or the eggs, right, the female egg, and the oocytes. Now, these oocytes at birth, every girl at birth has about a million oocytes, or a million ovum in the ovary. Remember that I said that the ovary is also bilateral, just like you have the bilateral testes in men, okay, testicles in men. The ovary is bilateral, you have one to the right and you have one to the left. Alright? Now, at birth, a girl has about a million ovum in the ovary. Alright, but as the baby grows into maturity and then gets to puberty, by the time the child gets to pubertal age, what you have left is just about 300,000. Okay, and during the menstrual stage, or the fertility stage of the woman, at every month from pubertal age, the lady or the girl begins to shed one ovum every month. Okay, so every month she has a menstrual period. What happens is you have an ovulation and then one egg is lost. The next month you have another ovulation and one egg is lost. Okay, so for each month an egg can come from the right or from the left. There's no particular pattern that decides where the egg will come from, whether it's the right or the left. But then it's also good to that I say that sometimes, right, you can have ovulation from the both sides, which means that a lady or a girl, a woman of childbearing age, can ovulate or release ovum or egg from both the right and the left ovary at the same month. Okay, now this is what brings about twin, alright, not just any twin, the type of twin that we call fraternal twin. Okay, like unidentical twin. When you look at twins that are not identical, most times the they are formed from eggs, ovulations that happen from both sides of the ovary. Okay, right. So I said that every month when we have is ovulation, an egg is released from the right or from the left, and during the period of the girl's uh, uh, active period where she is able to give birth to reproductive age. During her reproductive age, she will release between 300 and 400 eggs, and these eggs will begin to diminish and reduce. It will go from 300,000 until it is now completely depleted at menopausal stage, postmenopausal stage of the female life. Alright, so you have the a quick recap. I told you that a girl child has 1,000,000 egg, and by pubertal age you have about 300,000. And then also it is very important that I state that the quality of this egg reduces with age, which is why fertility, the chances of fertility also reduce with age. Okay, and this is as a result of reduction in the quality of the eggs that are produced. And this is why we advise that ladies, as much as it is possible, that you try to make your babies at early stage of your life. Why? Because as the lady advances in age, the quality of the egg cell also what diminishes, and this is where we now begin to have. That is why when you look at statistics, you see that women that are bearing, women that give birth at very advanced age, have more chances of giving birth to babies with birth defects. Okay, like Down syndrome and the others. Okay, so we also advise that ladies take time to plan their childbirth and try as much as it is possible to complete childbirth at early age. Alright, so okay, that is it about the ovary. Now I also need to mention that during ovulation, okay, that once an egg is released, it takes between 12 to 24 hours for the egg to survive. After 24 hours, the egg begins to disintegrate. If the egg is not fertilized, it disintegrates and then dies off. Right? Whereas a sperm cell, once it is ejaculated and released into the female body, can last between 4 to 7 days, right, until eventually it fertilizes an available ovum. Okay, so if a woman, which is also very important during child planning or birth control, okay, for those families or those couples that may not want to use IUCD, intrauterine contraceptive device, or that may not want to use alternative contraceptive device like drugs or condom. Sometimes some of these couples try to calculate their period, right? This is done because of the understanding of the physiology of the male and the female sperm and ovum. Okay, so I told you earlier that the egg can last between 12 to 24 hours, while the sperm can last between 4 to 7 days within the female, the uterus. Alright, so before we close, let me just quickly say a little thing about the menstrual period, so that we can now, I will not go deeply into it, because hopefully in our other classes we'll be able to deal with the menstrual period. It is very important as a woman that you understand the menstrual period. It will do a whole lot of good in your planning when it comes to childbirth, and also in your understanding of your physiology, just understanding of your physiology. Okay, so when we talk about menstrual period, basically you are looking at the menstrual cycle is divided basically into three stages, right? So we have the follicular stage, we have the ovulatory stage, and then we have the luteal stage. Now, some persons or some authors will divide the menstrual cycle into two stages, okay, which is the follicular and then the luteal stage. Now, the reason is because the ovulatory stage